Hi, I'm Autumn Grassel, and I'm going to talk about international organizations that are combating HIV and AIDS. The first program I'm going to talk about is UNAIDS, and it was launched in 1988, and it's designed to expand existing efforts by the World Health Organization. The UNAIDS strategy for 2011 to 2015 is stated as to advance the global progress in achieving country-set targets for universal access to HIV prevention, treatment, care, and support, and to halt and reverse the spread of HIV and contribute to the achievement of the Millennium Development Goals by 2015. So those are all the goals that the UNAIDS has, and the World Health Organization works side by side with UNAIDS. Both are multinational organizations that foster most of their organization through the United Nations, and most of the countries that participate in United Nations also have a vested interest in the fight against HIV and AIDS. The World Health Organization specifically lists their core activities on HIV as including improving the availability and quality of HIV-related medicines and diagnostic tools, of setting standards for scaling up HIV prevention, diagnosis, treatment, care, and support services, to monitor and promote health sector progress towards achieving universal access to HIV services, and to facilitate cohesion and collaboration among partners to achieve HIV-related Millennium Development Goals. Another organization is the International AIDS Society. It was founded in 1988. There are over 14,000 members in over 190 countries that participate in this organization, and it's an organization primarily for health professionals, so people who research, who are doctors, who work in clinics, or people who instigate medical policy and have a role in the policy-making field in healthcare. The goals of the IAS, as stated for the current 2011 to 2015 cycle, are to increase knowledge and skills and foster creative solutions and to challenges in the response to AIDS through dialogue and debate, to advocate for implementation of effective, evidence-based policies and programs to enhance the global response to AIDS, and to strengthen research capacity, identify research priorities across all disciplines, and advocate to address them. One thing that the IAS does is put on a bi-yearly conference. It's held every 2 years. There's usually about 5,000 delegates from all over the world. The delegates are leading scientists, leading doctors, physicians, public health experts, and community leaders, all of whom examine and debate the latest developments in HIV. The research is presented at the conference and breakthroughs are discussed, and also exploration of how to further the global response to HIV/AIDS is discussed, and people can take this back with them to their communities that they represent and enhance the quality of AIDS care that's being given. Another prominent organization that's more of a charity-based organization and not so much government-based, where some of the others are based through countries' government or through medical care professionals, is World Vision. World Vision is primarily charity. It is a Christian-affiliated organization, but it has donors from all denominations. World Vision is assisting in the fight of HIV/AIDS, and it has been for over 2 decades. They started its first HIV/AIDS prevention among orphan children in Uganda, children in Romania, and young women in Thailand who were in the sex trade. HIV and AIDS programs, or World Vision has HIV and AIDS programs in over 60 nations, and their 3 main areas of focus, as they state, are care, prevention, and advocacy. 5 ways World Vision helps in that fight for HIV and AIDS are they create a culture of care and concern, they encourage and support a community-based response to AIDS, they protect the rights of children and families, they strengthen families' ability to cope with the problems associated with HIV and AIDS and discrimination, and they promote HIV and AIDS prevention and awareness. One thing World Vision does also is it's on a very personal level. Usually it's person to person or getting relief from a specific person or clinic. Instead of a broad-based, World Vision really brings it down to a person-to-person level. Lastly, there's World AIDS Day, which World Vision is a sponsor of, as well as almost all of these other organizations participate in World AIDS Day. It was first held on December 1st, 1988. It was the first sort of global health recognition day. It's a worldwide call to action against the global pandemic that HIV and AIDS has become, and is designed to unite people in the fight against HIV and AIDS, to commemorate the lives of people who have died living with HIV or AIDS, and to show support for those currently fighting the disease. World AIDS Day is also a fundraising drive effort. Lots of money is generated to go towards research for HIV and AIDS on World AIDS Day. Red ribbons are worn by many people in order to show support. Most of you have probably seen the red ribbon, know what it represents. There's also a lot of product reds that are now being supported, and some of your profit from that goes to supporting HIV and AIDS research. Although World AIDS Day is a global health initiative, most of its events happen on the local level with local organization, making it something that unites us across the world, but on the local level also. Sorry about that. And that's all I have for international organizations, and now it's back to Calvin.